Hi, everybody. My name is Tim Huang. I am the founder and CEO here at Nitra. Nitra, what we're doing is we're building the AI native operating system for healthcare practices, primarily in the United States. So just a little bit of background on healthcare in the US here. Healthcare constitutes roughly about $5 trillion of GDP. So what that roughly means is that about $1 in $6 in the US is currently spent in some form of the healthcare industry, whether it's in hospitals or the biopharma industry, whatever the case is. One of the big challenges, I think, in the healthcare space is that roughly 25% of healthcare expenses, so about $1 trillion a year, is currently spent on some form of repeatable automation that happens in hospitals overall. And so these are things like billing, administration, checking for authorization with insurance, all these different tools that sort of exist, I think on the back end have really been sort of papered over by manual processes and by traditional financial tools. And if you think about sort of a typical hospital, what they're doing is they're essentially stitching together multiple sort of traditional legacy solutions. So these are things like credit cards from American Express or lending solutions from individual banks, expense management solutions from companies like Bill.com or SAP, and then buying specific drugs or equipment specifically from companies like McKesson, Henry Schein, Allergan, or others that really kind of create a very disjointed and challenging opportunity for hospitals in the country. At the same time, on the healthcare side, you do see a huge fragmentation of individual software tools that each individually do different things. So on the patient management side, companies like Athena or eClinicalWorks, EHRs, so electronic health record solutions, or billing and insurance solutions really provide an extremely disjointed opportunity, especially when paired with many of the horizontal financial tools that exist out there. And so at Nitra, what we do is we build an all-in-one comprehensive financial platform for independent practices and clinics and hospitals who are really trying to kind of stitch together a all-in-one solution to be able to handle credit cards, payments, insurance billing, accounting, and other administrative tools, really for the next generation of healthcare practices. So at Nitra, what we do is we kind of have three major divisions in the company today. First is our fintech division, where we provide credit cards, payment processing, banking solutions, insurance billing and processing specifically for hospitals and clinics. What we did actually last year was, in addition to looking at the fintech solutions, we looked at what people were purchasing, right? So these are things like biopharmaceuticals, medical and surgical equipment, and built an entire e-commerce engine specifically to help doctors and hospitals really try and identify and the lowest prices specifically for many of their particular products. And then finally, we built up an AI division that does everything from AI-based accounting, procurement, payments, staffing, and recruiting for our hospitals overall. And when you look at the sort of ecosystem of providers between a doctor and a clinic and all the different constituents, right? So whether it's the biopharma companies, the surgical equipment companies, healthcare employees, patients and other providers, I think, in the ecosystem, what you can see here is that there are various different ways in which we can leverage software and financial tools to be able to create the right workflow capabilities and really build that all-in-one kind of comprehensive solution for our providers. And so what we did essentially when we were building the company here was to really combine all the different ways that doctors get paid and all the different ways that doctors can spend money, and are able to essentially kind of combine those into different solutions. And in every case, we combine a core financial service, let's say like a credit card, with some software like expense management, and then some level of AI, let's say like automated accounting or some form of automation that helps drive these outcomes. Nitra Mart is a good example where, as I mentioned, we were essentially bringing together everything together where you can provide and use your Nitra card to transact at Nitra Mart. And really be able to kind of combine these solutions into one singular and all in one place. And really kind of the AI solutions here touch everything you can think of, right? All the things we were talking about before, AI finance, claims management with insurance, patient management capabilities, and procurement capabilities that really unify financial operations, procurement operations, patient management, and overall kind of operations, I think, for a particular clinic overall. Nitra over the last several years has grown quite tremendously. These are our transaction volumes as we've seen them over the last several months. We've grown quite a bit just in the last year or so. In 2025, we grew over 700% in terms of our transaction volumes we do for our customers. And then finally, between myself and Jonathan, we are multi-company unicorn founders. For us, Nitra, this is our second venture-backed business ever, taking our first company through an IPO. And we're very excited, obviously, to kind of bring together our experience as well as one of the biggest industries in America and really bring a lot of innovation there. And so that's Nitra. We are building the all-in-one category-defining financial operating system for American healthcare. Thank you.